Good afternoon, everybody. My name is Dr. Jide Gabi-Williams. I just want to say welcome to all of you who are joining us today for our annual lecture event in honor of my father, the late Dr. Gabi-Williams. The title of my talk is going to be Alzheimer's Disease, the Challenge of Communication. So the Gabi-Williams Alzheimer's Foundation is a Nigerian-based NGO that was established to help bridge the gap in services, resources, and care for Alzheimer's disease in Nigeria. It was established in honor of the life and the work of Dr. Gabi-Williams. I'll begin by just showing what the brain of a patient with Alzheimer's disease looks like versus the brain of a patient who is aging normally. On the left side of the screen, you'll see a normal brain. This is a true photograph. This is a photograph of a real brain in our lab. And you can see that the brain looks very full. It has the sulcal grooves in between the gyruses, which are that's where the cortex of the brain is. And just for simplicity's sake, if you look at the left, the normal brain versus the Alzheimer's disease brain labeled AD, what strikes you the most? Well, what strikes me the most is that the Alzheimer's brain looks a lot smaller. It looks a lot more shriveled up. It looks almost dehydrated. And you can see the grooves look wider, the so-called sulci look wider, and the gyruses, which are where the brain cells are stored, look a little smaller as well. This smaller, more shriveled up brain is what we refer to as atrophy of the brain. And the bottom half of the photograph just shows a different way of viewing it. This is a cross-sectional slice through the brain. It's what we call a coronal slice through the brain. And you can see, again, the normal brain looks fuller with tighter sulcuses or grooves and fuller gyruses where the brain cells are located, versus the Alzheimer's brain where you can see how shriveled and atrophic the Alzheimer's brain looks. The reason for this atrophy that you see on this slide is because of what we refer to as neurodegeneration, which is when the brain cells begin to degenerate. They begin to die off. And once that dying off process begins, it reaches a critical threshold after which the individual starts to exhibit symptoms of dementia. So the shriveling, the atrophy is caused by neurodegeneration, which is loss of brain cells, and it's a progressive loss of brain cells that take place that leads to that smaller, more shrunken appearing brain. The challenge with dementia, especially in Nigeria, but this applies to everywhere else in the world, is that people generally underreport the symptoms of dementia, sometimes because they confuse them with the normal signs of aging. Oh, Baba is just getting older. And when you begin to confuse them with the normal signs of aging, you are missing the opportunity not only to make the diagnosis, but begin to institute treatments that have been shown, when started early, can prolong the individual's ability to have a quality life with their family members. So it's important to make the diagnosis early, because we know that early diagnosis leads to early treatment. And even though there is no cure for Alzheimer's disease, some of these treatments that we start early can slow the progression of the disease. And so it's important for us not to confuse Alzheimer's signs with the signs of aging. The symptoms also can appear so gradually that the individual who's affected doesn't even recognize them. The individual might actually recognize them, but might go to great lengths to conceal these symptoms because the individual feels embarrassed or ashamed of these symptoms. And the shame can extend to the family, especially in Nigeria, where we see families concealing the problem, hiding their loved one for fear of victimization, for the fear of the social stigma around Alzheimer's disease. And so let's talk about the symptoms of Alzheimer's disease. What are the symptoms of Alzheimer's disease? And there's a simple acronym that I like to use to teach symptoms called FLOW, F-L-O-W. And through this acronym, you'll be able to capture, we are able to capture the most prominent symptoms, especially the early manifestations of Alzheimer's dementia. So F in FLOW stands for forget. So the individual might forget words, forget words very easily, forget conversations. They might forget familiar faces and even places. They might forget they just said something or asked something. And what you often find is because they're constantly forgetting that they asked something or said something, you hear them repeating themselves. They start to repeat themselves over and over again. And sometimes this repetition is what raises concern among family members. The L is for lose. Alzheimer's patients might lose important things all the time, or they might lose interest, become more withdrawn, or they might even lose their way of getting around places that should otherwise be familiar to them. O stands for overlook. Alzheimer's disease patients might overlook important things like paying the bills. They might, overlook, safety issues like leaving things burning on the stove. Or they might overlook the importance of dressing adequately, whether to go out to a function or even dressing adequately for the weather. You find them going out, in a t-shirt or in a singlet when it's raining, without even bringing an umbrella, for example. And they can also overlook taking their medications. And this is another reason why it's really important for Alzheimer's disease patients to be diagnosed early so that they can be supervised, because not taking their medications can lead to problems with other conditions that these patients might be suffering from. W stands for right. And Alzheimer's disease patients often, especially in the early stages, start writing down lists so that they can remember things easily, or they might be using reminder notes, to-do lists so that they don't forget to do things. And we see this more among Alzheimer's patients who are literate. Now, there are obviously different, this won't obviously occur in patients who are more illiterate, but this is one of the things we see in our literate patients. But W can also stand for wonder. And this applies to every Alzheimer's patient. And what happens is that they start to wander around with no place to go, and they can get lost. They can put themselves in danger. Again, another reason why it's very important for us to really supervise and watch over these our loved ones with Alzheimer's disease, so that they don't end up putting themselves in danger. And I'm going to show a video that was developed and produced by the Gabi-Williams Alzheimer's Foundation that really shows these symptoms in action, including and especially the symptom of wandering.
Mommy, Ekasoma, what do you do here?
Who you be?
Na me, Ngozi, your pikin friend.
I just waka comot for house. I no road go back house.
Oh, na your house I dey go sef to see my friend Dupe. Mama, enter car, make I carry you go house.
Ngozi, welcome. Oh. For when you see my mama, I don't even know say she don't waka comot for house. Mama, where you go?
I see your mama for that busy Obalende motor park all by herself. When I approach her, she no even recognize me. She dey ask say who I be.
Ngozi, thank you. Thank God say you see am o. E get as my mama dey behave now. She don forget everything. That day na so she no remember my name. I no believe am. Na so she lost her glasses and her money. Shebi you see, if no be say you see am, na so she for take lost. Egba mi o.
I think say this one na Alzheimer's disease o. Na the signs be that. Alzheimer's disease na disease of the brain. When dey cause memory loss, e dey make person dey forget people names. They go dey lost things, forget how to do simple everyday things. Dem fit waka lost sef comot for house, just as your mama do today so. Na typical example be that. The best thing now na to carry her go see doctor, make dem for check am.
So I'm going now to focus on the changes in communication that we see in patients with Alzheimer's disease. In general, men with Alzheimer's disease tend to retain their verbal skills better than women, especially during the early stages of Alzheimer's disease. But this loss of ability to speak or understand speech correctly is devastating for all patients, but not just for the patients, but also for their loved ones. So what is responsible for these communication problems that we see in Alzheimer's disease? Well, if you look at the areas that are affected early in Alzheimer's disease, these areas are the temporal lobe, which is the area in blue here. And this is where our memory centers in our brain are responsible. And this is one of the first places to be affected by Alzheimer's disease. And it's one of the reasons why memory dysfunction, especially short-term memory dysfunction, is one of the early manifestations of Alzheimer's disease. Another place that is affected in Alzheimer's disease, shortly after the temporal lobe or the memory centers, are the frontal lobes, especially the areas that are responsible for our judgment and for our behavior. Again, this is why we start to see these behavioral problems with Alzheimer's disease. But in addition to memory, as we go further back into in the temporal lobe, we start to have areas responsible for language, and these language areas in the temporal lobe also extend into the parietal lobe in the brain, and these language centers in the parietal lobe and those in the temporal lobe, which is shown in green, become affected in Alzheimer's disease. And in fact, there is a type of Alzheimer's disease that actually begins with language dysfunction, but the majority, as I mentioned, begins with memory dysfunction. And so, as these areas become involved, the memory centers, you have memory dysfunction, and then the language centers, you have language dysfunction, which we call aphasia, and then the frontal centers causing problems with behavior, judgment, and even attentional problems. And these are what we start to see early in the stages of Alzheimer's disease as this atrophy continues to progress. But ultimately, the entire brain, as you can see in this photograph again, becomes atrophic. And what began as just some minor speech problems or memory problems or behavioral problems progresses and gets worse over time with each stage of Alzheimer's disease, until ultimately the patient is no longer able to comprehend or even speak. But what we've noticed with Alzheimer's disease, and this has therapeutic value, is that their ability to process music is relatively preserved. And that is because the music centers in the brain tend to be much more dispersely located in the brain. And they tend to be spared until very, very late in the disorder. And so patients with Alzheimer's disease can still really enjoy music, appreciate music, In fact, we use music to treat agitation of our patients, and they can even sing to popular songs that they enjoy, even though they might not necessarily be able to speak as well as they can sing. And so music has therapeutic value, and it can be very, very an effective way to really to address some of the communication challenges that these Alzheimer's patients have. So let's go through the loss of communication by stage of dementia. In the early stage of Alzheimer's disease, you see difficulty concentrating and following conversations. We also see difficulty finding the right words when spoken to, when speaking, and even when writing. Patients can lose their train of thought when they're speaking, and again, you see them, you hear them repeating themselves very often. They're also not aware of these problems, especially early on, and they might try to hide the problem or overcompensate for the problem. In some cases, they become very defensive, even aggressive. They can become very depressed and anxious. And this frustration and this depression and these more emotional symptoms extends that is not limited to the patient, but also to the caregiver, who experiences tremendous anxiety and can experience tremendous depression from watching his or her loved one go through this early stage. When you get to the mid stages or the moderate stages, all of these symptoms progress. Patients now start having really difficulty following even one-on-one conversations. They lose their train of thought much more easily when they're speaking. They find it increasingly difficult to find the right words when they're speaking or even writing. The vocabulary constricts. They really, can't find the nouns to use. They start substituting words that are not the correct words, but they sound like the correct words, or they might even start inventing new words. And all this makes their speech quite incomprehensible. And this is, again, a manifestation of the aphasia that we see as Alzheimer's disease progresses. The difficulty following storylines is something we also see, and that can occur with newspapers or with books or TV shows. When my father was diagnosed with Alzheimer's disease, he was writing in the middle of writing a book, and we were all very excited about the book that he was writing, but over time, he was no longer able to write the book, and he basically abandoned the book, and just unable to complete the book because the disease prevented him, because it also affected his writing and not just his speaking. And sometimes the writing challenges might be an early manifestation of the problems, and that's why, even though my dad at the time was able to speak and converse, his writing was affected really early, and it really prohibited him from really writing and completing his book. And then directions, following directions is another thing that we see at this mid stage, and they have difficulty following directions. They have poor recall for recent events, and then they start using more gestures to communicate. These are again reasons why it's very important to really support our Alzheimer's patients and also support our caregivers during this stage of the disease. When we get to the late stages of Alzheimer's disease, patients now are just unable to follow along with anything other than very simple conversations and instructions. They really do lose their vocabulary, including personal information. They might forget the names of their loved ones. They might even fail to recognize their loved ones. And then there's a tendency really to ramble or babble or just not say anything at all. And this is what we start to see during those late stages of Alzheimer's disease. And ultimately what happens as the disease reaches the end stages is that these patients are no longer able to speak. They're no longer able to even respond verbally, and they're no longer able to understand what's being said to them. And they just become nonverbal, they become mute. And again, tragically, we experienced this with my father, the great Dr. Gabi-Williams, also. And so communication problems are a challenge. They are heartbreaking. They are tragic, not just for the patient suffering, but they can also be of a great burden and a great challenge for caregivers. And I just want to end with this wonderful poem by Owen Darnell that really captures the tragedy of Alzheimer's disease for the family and the patient that are going through this. Do not ask me to remember. Don't try to make me understand. Let me rest and know that you are with me. Kiss my cheek and hold my hand. I am confused beyond your concept. I am sad and sick and lost. All I know is that I need you to be with me at all costs. Do not lose your patience with me. Do not scold or curse or cry. I can't help the way I am acting. Can't be different though I try. Just remember that I need you, that the best of me is gone. Please don't fail to stand beside me. Love me till my life is done. And on behalf of the Gabi-Williams Alzheimer's Foundation, and in honor of my father, Dr. Gabi-Williams, I thank you for joining us today. And I will now hand over to my dear cousin, Ms. Bola Oshikonlu, who will really talk about ways that we can address these issues, these communication issues at both the patient level and the caregiver level. Thank you all for joining us today.
The Gabi-Williams Alzheimer's Foundation, GWAF, is a charity organization established to promote Alzheimer's disease awareness and reduce its related stigma in Nigeria, as well as identifies and strengthens the available patient and caregiver infrastructure for Alzheimer's disease in Nigeria. GWAF is a partner of the Federal Ministry of Health and recognized by the Alzheimer's Disease International, ADI. Since inception, GWAF has undertaken commendable interventions and programs. GWAF has continued to fill the gap in dementia and Alzheimer's disease awareness, services, and advocacy in Nigeria. For further information, visit www.gabi-williams-alzheimersfoundation.org. Your support is highly needed for us to achieve more. Who can support us? Philanthropists, corporate organizations, donor groups, associations, and individuals. How can you support our projects? Direct material aid to aged people's homes, clothing, food and medical consumables, bedding and sleeping materials. Free medical service to aged people's homes. Adoption and sponsorship of specific GWAF interventions/programs from our annual work plan. For financial support and donations, to give direct monetary donations, please visit www.gabi-williams-alzheimersfoundation.org/donation. Enter your details, the currency, amount, and card info on the payment platform, and we will acknowledge your donation. We count on your anticipated support.
Mommy, Ekasoma, what you dey do here?
Who you be?
Na me, Ngozi, your pikin friend.
I just waka comot for house. I no know road go back house.
Oh, na your house I dey go sef to see my friend Dupe. Mama, enter car, make I carry you go house.
Ngozi, welcome. Oh. For when you see my mama, I don't even know say she don't waka comot for house. Mama, where you go?
I see your mama for that busy Obalende motor park all by herself. When I approach her, she no even recognize me. She dey ask say who I be.
Ngozi, thank you. Thank God say you see am o. E get as my mama dey behave now. She don't forget everything. That day na so she no remember my name. I don't believe her. Na so she lost her glasses and her money. Shebi you see, if no be say you see am, na so she for take lost. Ẹ gbà mí o.
I think say this one na Alzheimer's disease o. Na the signs be that. Alzheimer's disease na disease of the brain. When dey cause memory loss, e dey make person dey forget people names. They go dey lost things, forget how to do simple everyday things. Dem fit waka lost sef comot for house, just as your mama do today so. Na typical example be that. The best thing now na to carry her go see doctor, make dem for check am.
8 early signs and symptoms of dementia. 1. Memory loss. 2. Difficulty communicating thoughts. 3. Rapid agitation and mood swings. 4. Disregard for grooming and personal hygiene. 5. Lapse in judgment. 6. Misplacing things. 7. Lack of initiative or apathy. 8. Getting confused often.